This is Whiskey Bravo 5 Delta. The grand rounds of the internet. We meet weekly at this time. We have a passion for healthcare related subjects. We use amateur radio to discuss them here on shortwave, which we need to bands specifically. We are doing a Zoom simulcast today. We're going to be exploring the origins, the effects, and the safety considerations of these drugs. In 1 minute here, I will get started. Just a second, guys. Whiskey Bravo 5 Delta, thank you for everybody that's here with us. And check if we have any late check-ins, you'll let me know. So we've got WJD with us, thank you. Stewart, W89ZBO, we have N3IM, we have Keith with us. We may have a few others join before we actually start our topic discussion. Do you have any other check-ins? Make a call.
WING. Good morning, Jay.
Good morning, WD9, WD8ING, I believe. Just trying to make sure about, yes. Thank you for being here with us. Nice to hear your voice as well. Any other check-ins?
KN0S.
Dave, KN0S. Also, thank you for being here. I'm sure you'll both be participating today. We appreciate that. It'd be nice to have some discussion going on today. Any other further check-ins? Can I get a relay on that? Someone's trying to check it. Can we get a relay, please?
Relay. That's zipper, November, Tango Sugar Charlie, November 4, Tango Sugar Charlie.
Okay, thank you, Jerry. November 4, Tango Sugar Charlie, we have checked in. Any other further check-ins? We'll pause through our roundtable here for additional check-ins. But as we talk about non-steroidal anti-inflammatory drugs, especially the over-the-counter versions, realize that we talked about Tylenol a few weeks ago because that was in the news. That's not a member of this class of drugs, totally different action. But it is in the news. And the question is, with Tylenol being suggested not to use so much in pregnancy, what are your options? Are these medications an option for individuals? We'll touch that, do a little bit of comparison.
Jay, can I interrupt?
Okay, go ahead.
Your Zoom volume is very low. HF volume is great, but the Zoom, your own voice is low on Zoom.
Is this better now?
Much better, thank you.
Okay, thank you for letting me know. And this is Whiskey Bravo 5 Delta. We're operating out of Hawthorne, Florida. So if you're pointing your antenna, point it in this direction. And this is AA4FL at the microphone. The call, Whiskey Bravo 5 Delta, is our club call for the Medical Amateur Radio Council. We've been in existence since 1966. That's when we were formed, and our on-the-air nets include discussions of health-related topics. We have a passion. Many of our members are in health-related fields, but many are not. And we have a passion for topics in this realm, and we share these with each other in a roundtable fashion, as many radio nets do. Many varied subjects that groups of amateur radio operators get together to discuss. This is for personal interest. It's not medical advice, and it's not treatment recommendations. This particular presentation or discussion was aided by AI, some of our talking points. For those of you that are on 20 meters, if you would go to the website healthcarehams.org and look at the posts on the entry page, you will have a link to this to the background material, to the slides that I'm using as a prompt for these discussions. In addition, when you do look at those slides, you'll see that they have underlying text, hypertext. So even though this was created with AI, it's been expanded. And of course, the AI has been reviewed for the content, but to make everything have a scientific basis, we link to articles of interest. So if you're an amateur radio operator, it's not in the medical field, you won't necessarily be burdened with the science, but if you are a member of the Medical Amateur Radio Council, and not all our members are in health-related fields, you have some open source information that's available on the internet of more detail. I hope you'll take advantage of that. Just a look at how we're going to guide this discussion. The origins and historical development of NSAIDs, the non-steroidal anti-inflammatory agents, pharmacological mechanisms and their therapeutic applications, how we use them, and how they work, the health benefits, the positive outcomes of the use, and also the risks, side effects, and safe use, and the current perspectives and future direction. So looking at the historical development of these medications, if you go back into antiquity, there's always been traditional natural remedies, and this was the source for non-steroidal anti-inflammatory agents. They started with noticing that natural substances such as willow bark, they were historically used to alleviate pain and reduce inflammation. And if you look up folk medicine and traditional healing, you can read more, and you might want to look that up in combination with NSAIDs. But this is the groundwork of the foundation for modern drugs and these classifications. And non-steroidal anti-inflammatory drugs are one of the most frequently prescribed drug classes that have a wide therapeutic application over the centuries, starting with the willow bark and giving salicylic acid, the willow leaves having that containing in the leaves, and they figured out how to make aspirin. And now they made aspirin, now they've moved on to find other drugs to meet other needs that have similar mechanisms. The science marches on. So the challenge has been to increasingly be attractive as the inflammation as a common seed and underlying mechanism for most chronic diseases exists. So we need to be able to address that. And we're in the spotlight for repurposing against inflammation-related disorders. A lot of the science is following that path. I'm going to just ask for a moment here, Stuart, WA9ZPL, if he has any comments, because in health practice, I'm sure he used some of the prescription level items too of that source. WA9ZPL, Whiskey Bravo 5 Delta, go ahead.
WA9BPL. Specifically about the prescription options that are out there. There are more than 50 5-0 prescription in the United States market at one time or another, plus others that are only outside the United States, and there are others in the pipeline. It's impossible for anyone, even super specialists, to keep up to date on more than 50 drugs like that. So my first advice is to try to pick 2 or 3 that are worth studying, and to have better funded knowledge regarding those. And I can explain some examples. Copy that, over.
Yeah, QSL, if you'd like to give some examples, go ahead, Stuart.
In the prescription arena, I think you need to have something that's long, such as ibuprofen, which is commonly used as a short-acting. The reason you need a long-acting option is because you need to have that will last all night. If a person has, let's say, musculoskeletal pain and they can't sleep through the night, they need to have something they could take at bedtime that will last through the night. And you also, of course, want something with a favorable side effect profile. And so my example for today's purpose would be Sulindac. Sulindac is also known under the brand name Steroidal. This is a non-steroidal anti-inflammatory drug that lasts for 12 hours and may be a suitable alternative for people to speak with their treating physician about. Over.
QSL, well, thank you very much for that description, Stuart. And we certainly will highlight some classes or some different drugs here today. And hopefully you can go on healthcarehands.org and bring up the slides that we're using as a prompt. And those are listed here. We're having a little bit of an issue on getting the Zoom audio onto 20 meters. So we're probably just going to rely on input on 20 meters here today on the radio. So if you've got the ability to go on HF and operate, let's do it that way rather than Zoom audio. So this is Whiskey Bravo 5 Delta. We'll be looking for perhaps Stuart can get on HF and do a little bit more description here. Would that be possible, Stuart?
I am on HF. Are you not copying my HF signal? Over.
Oh, yeah. Yes, we are copying the HF. It's just not making it into Zoom. Over.
Okay. I'm not sure why I'm not making it into Zoom. I'm definitely on Zoom. I have to look into some of these adjustments. My other comment has to do with over-the-counter.
Hang on a second, Stuart.
Naproxen is available over-the-counter, and that has a relatively long half-life to some of the other options, and that's something to be aware of. It's available in an over-the-counter strength, and it's also available in a prescription-only strength. Go ahead.
Okay, Stuart. Could you, it's not an issue on your side, Stuart, it's an issue on our side. Could you unmute and come in through Zoom, please, and just repeat?
Okay, my comment had to do with naproxen, which is relatively longer acting than ibuprofen and some of the other over-the-counter products. And naproxen potentially could last through the night for someone with insomnia due to musculoskeletal pain. Naproxen is available in an over-the-counter strength, and it's also available in a prescription strength. So that might be another one of the short list of products that people may want to try to familiarize themselves with. Over.
Okay, thank you. Thank you very much. You can go ahead and mute again. Sorry about the technical problems. We're totally on this end. And probably more round table other than HF. So this is Whiskey Bravo 5 Delta, Grand Rounds in the Internet, talking about non-steroidal anti-inflammatory agents from a historical perspective. I know Stuart is here with us for a short period of time, and he's needing to go off for an obligation, as many have on Sunday. We have members, of course, that've got to get to church, as well as social activities. But in the past, the use of aspen willow leaves, it dates back, it's very well documented, and dates back again in antiquity. But owing to the developments in the fields of chemistry, the isolation of the active ingredient called salicin was carried out by a German pharmacologist in the late 19th century. And a few years later, an Italian chemist found a way to extract the salicylic acid, which is the primary compound for the synthesis of aspirin. Of course, we know, many of us, that we take that when we have a tendency to have heart disease for a number of different reasons. We're trying to control inflammation in the heart. The advancements in the 20th century of these drugs, though, numerous drugs were developed with varying chemical properties to treat inflammation more effectively, to improve efficiency, different formulations that enhance the ability to reduce inflammation and relieve pain, and to also have more safety margin. There's over-the-counter, there's prescriptions as well, based on the strength of the formulation. Some are available to be over-the-counter, and some now that previously were not allowed to be over-the-counter. Currently, they are. And of course, there's ones for more serious conditions that are not available over-the-counter. And if you go on drugs.com and you look up NSAIDs drugs, NSAIDs drugs, you can see a list of the common NSAIDs, just like Stuart had mentioned. And you can find the detail there, and the different classes and the different drug names in a very practical and easy method here. So if you're on 20 meters, again, that's drugs.com, and just look up NSAID drugs, and you'll have the full detail there. What about the mechanism and the therapeutic applications? Well, commonly treated medical conditions are things like arthritis, as Stuart mentioned, musculoskeletal injuries or pain. There's also menstrual cramps, and that's been used for decades. And what about this compared to Tylenol? I mean, it's more effective for cramps than Tylenol is, or it's purported to be. It's used more commonly. But if women are so used to using it for cramps, how many are aware that there could be potential problems that are even more severe for NSAIDs than Tylenol in pregnancy? There's been a lot of press recently about Tylenol in pregnancy. We don't know if the research is totally valid at this point. It's still undergoing. NSAIDs, the research is more indicative of what happens during pregnancy. So how can they help you? I mean, what are the side effects? They can be used to treat pain and fever from long and short-term medical conditions. So let me pause one here on 20 meters and just ask if there's anyone here on 20 meters that would like to ask a question. This is Whiskey Bravo 5 Delta, looking for any questions on 20 meters. Okay, the WA1, would you repeat your call, please?
Echo X-ray alpha, Echo X-ray alpha.
Repeat one more time, please. X-ray Echo Alpha, QSL. Oh, Mark, okay. I'm sorry. Of course we know who you are. Echo X-ray Alpha, thank you for being here with us today. It's good to hear from you from the Cape. Life is treating you well, Mark. Glad to have you back. Do we have any further check-ins? Again, this is Whiskey Bravo 5 Delta, Grand Rounds in the Net, operating from Hawthorne, Florida. AA4F Delta Mike, make your call.
WA9 ZPL follow-up.
Go ahead, Stuart.
Before I go, I wanted to put one other topic of discussion on the table, and that is what medications not to use, what medications are inappropriate, contraindicated, or ineffective. And I want to nominate three things. One would be steroids, such as cortisone. Maybe not a good idea. Number two would be muscle relaxants. There are a long list. I believe they're all prescription drugs. And number three is gabapentin. Gabapentin is an anti-epileptic drug that sometimes is used off-label for other purposes. So the avoidance list are steroids, muscle relaxants, and gabapentin. Over.
QSL, Stuart, thank you for bringing that up. I've seen that off-label use from gabapentin in the dental clinic there at the University of Florida. Now, isn't cortisone, is that a steroidal medication?
Right. Cortisone is perhaps one of the best known steroids. Prednisone is another example. And these medications can have a lot of side effects, and they don't specifically target acute pain.
Okay, thank you. Appreciate it. Anything else before I depart,
And look for you next week.
7-3 store. This is Whiskey Bravo 5 Delta for identification. That was Whiskey Alpha 9 Zulu Papa Lima contributing to our roundtable here today. Do we have input now? Mark, WA1EXA, you of course, being a pharmacist, you'd be familiar with these medications. And historically, I mean, you're a pharmacist for many years. You firsthand have seen the development. Do you have any comment that you'd like to make, Mark? Over.
Side effect with this not steroidal aware of the fact that steroids and non-steroids, including aspirin, should be avoided.
Okay, thank you. Thank you very much for your input there, Mark. We do appreciate it from a pharmacist. And of course, side effects, as Mark mentioned, can be a problem, but particularly when you're using it at higher than recommended dosage for a long period of time, things like gastrointestinal side effects. Now, Mark just mentioned the kidney effects and the problems that you can have there. Some of the gastrointestinal effects, diarrhea, constipation, irritation of the lining of the stomach, or vomiting. The kidney function, it reduces how quickly blood flows through the kidneys, and that can cause retention of sodium in water, which can lead to edema or swelling and high potassium levels. And high potassium levels is an indication in blood work of kidney function. So occasionally there could be more serious damage to the kidney. So you have to be really careful if you have any kind of kidney. We'll talk about that a little bit more here too. And some of the ones that are COX-2 enzymes, the ones that Stuart had mentioned, clofenac, have a high risk of cardiovascular thrombotic events, such as heart attack or stroke. So again, we have to be careful on our dosages. And other heart-related effects, such as high blood pressure, congestive heart failure, and palpitations, have also been reported. But again, therapeutic index, we talked about this last time. Be careful what you use, and you certainly don't want to overuse it. Just because it's potential doesn't mean that it will occur. So this is Whiskey Bravo 5 Delta for identification. Do we have anybody else that would like to check in and join this roundtable discussion or going on the internet? Make the call to Whiskey Bravo 5 Delta. Yeah, No further check-ins at this time or comments at this time. Well, COX-2 is in acute pain and the use of selective inhibitors for acute pain relief. So they keep on developing these classifications. I know when I was a dentist, that was something that happened during the latter half of my career. Those particular class of medications was fairly new and useful at that time when the research was being done. And how does COX enzyme work? Well, they produce prostaglandins that mediate pain, inflammation, and fever in the body, the role of the enzymes. So if you inhibit them, you're inhibiting inflammation or swelling. The study is still there. You can look up studies on the internet. Look up one for NSAIDs between past and present, a long journey towards an ideal COX-2 inhibitor lead, and you'll find very extensive descriptions from the scientific basis of what they're trying to accomplish and what's going on in current research. Some of the articles that you find may actually be, quite old, and then some of them that you find online might be newer, 2024, 2025. But do realize that when you're on the internet, go to reputable sources that come in, and also realize that many of these are scientific journals, and you'll only get an abstract. I think we have another check-in here, W9MET. Thank you for being here with us. I'll get you checked in, John. Thanks for being here. What about the health benefits and positive outcomes of NSAID use? Well, we talked about pain reduction, pain relief, anti-inflammatory action. There's a link. If you go to healthcarehands.org and look at the slides that we're prompting our discussion off of, you'll see an editorial, a link to an editorial on the causes of disease, inflammation, the cause of all disease. And if you read the research, the causes of disease and inflammation's part, doesn't have to be from that editorial. You'll find out how important it is to control inflammation. Of course, we can reduce fever. We can decrease postoperative pain, use it for pain management, depending on the level of pain. It may be over the counter. It may be prescription and dentistry a lot of the times. We're using over the counter medication. What about long-term chronic pain sufferers? You have to be careful with that. It can improve your daily function. But you don't want to overuse and get the side effects either. What about the risks and side effects and safe use of this class of medications? We talked about the gastrointestinal complications, things like bleeding ulcers and irritation, development of ulcers. And if you go on again to the slides, you'll have an active link to look at some of those scientific articles. And for those of you that are in health-related fields and you want to read more detail, or if you're a general member of the amateur public and want to read more about it, there's some selected articles that are more than just abstracts that you can access and read about, and certainly share this with friends and family. Now, what about cardiovascular and renal risks, heart attack and stroke? There can be a risk, increased risk of heart attack and strokes. Kidney damage risks are well known from high doses of prolonged NSAID use, even for those of us that don't already have kidney disease. So you have to be careful. You don't want to have acute kidney injury. You don't want to have chronic kidney disease result from misusing medications. And pregnancy, well, we talked about pregnancy a couple of weeks ago. We talked about Tylenol. And you can view a video of that Tylenol. Just go to a Healthcare Hands YouTube channel. And later today, your Healthcare Hands YouTube channel, you'll be able to get a recording of today's roundtable discussion as well. So what about the use during pregnancy? Do we really know? There's a lot more that's known. And a key part is knowing the therapeutic index of medications considered to be the ratio of highest exposure to the drug that results in no toxicity. And even though Tylenol wasn't really talked about in that vein. Maybe we're humanizing the situation. It's been talked about recently as the potential for having increased autism, but think about Tylenol being one of those medications that really doesn't have a big range between what's safe and what's therapeutic to use. You can overuse it, overdose on it easily. And think about a developing fetus and how small they are. I think conventional wisdom that needs to be studied as well, not just the autism. With non-steroidal anti-inflammatory agents, that's much more well known. And the other question is, again, one of these development questions is that fetus is developing. Can it cause kidney disease that will show up when the child is born? So there's some articles linked to, if you go to those slides on the website, I think you'll find that to be eye-opening, something to consider. I'm going to break one here for ID. Whiskey Bravo Flight Delta Grand Rounds in Air Net. We hold our net every week at this time. We have had for many years. This is just a discussion of health-related topics, in this particular case, class of medications. It's not medical advice. It's not medical recommendations or diagnosis. It's just a net, and we have a passion for discussing these topics that are health-related, just like many of you have other nets that you participate in that you have a passion for this discussion with. So what about during pregnancy? What about NSAIDs? What did the research come out to be an issue? 20 weeks or later in pregnancy, it could cause rare but serious kidney problems in an unborn baby. We just talked about that. They've changed the recommendations in 2020 because of some of the research. At 30 weeks, it can cause a problem that may result in heart issues in the unborn baby. One exception in NSAIDs is aspirin. It is an NSAID. Low dosage aspirin is not, according to the research that I saw, not contraindicated, but we're talking about the very low dose. What about best practices for minimizing side effects? Well, common sense. Use the lowest effective dose. You never want to take more of any medication than you need. Now, even though you might be allowed, and you're, for example, say you're taking ibuprofen, which is, and you can take 2 or 3 at a time. It's suggested 200. Prescriptions would be 600 or 800. But why would you take more than you need? The over-the-counter would be adequate. So you restrict them for the shortest time necessary to reduce the risk of adverse effects. You can also, with pain after procedures, alternate with Tylenol. You're not taking as much as well. As you have breakthrough pain that starts to go away, you have to monitor, physicians need to monitor the effectiveness during the use and consider alternative therapies as well. Do we have any questions on 20 meters? Any comments? Make your call to Whiskey Bravo 5 Delta. What about the future? Well, as I said, there's still a lot of research being done. Inflammation being a very high contributor to many diseases. There's a big focus on research on these drugs and creating new drugs that have better tendencies to reduce inflammation while minimizing the side effects that we've been discussing. What about personalized medicine, risk assessment? We're starting to get into an era of genetic data integration in the future. You'll be able to look at your own genetics and match what drug works best for you. It's already being done. It's expensive in other venues of high-risk cancers and such. And, with AI, we can do critical risk profiling in the future as well. Being able to use AI to tie everything together. The historical data, your particular family history, genetics, your individual genetics, and look for more movement in that direction, to have tailored therapies that reduce the adverse effects, that enhance the treatment outcomes for you as individuals. That ongoing research, just keep on improving the drug efficiency and find some novel anti-inflammatory agents to meet the diverse needs of our population with fewer side effects. Do we have any other comments on 20 meters? Make your call to Whiskey Bravo 5 Delta. Do we have any further check-ins on 20 meters? Make Okay, in conclusion, we've talked about the impact of these medications, the need for caution and the future treatments. And thank you for taking part in the roundtable discussion. And for those viewing the recording on the Healthcare Hams YouTube channel, and for further comments, you can visit healthcarehams.org. At this time, I'm going to keep a Zoom session going for our net. And I'm going to be closing the 20-meter section of the net and be returning 20 meters to general amateur use. So thank you for participating. Next week, we're going to be talking about hot tubs and some of the risks and benefits of hot tub use. There are some medical considerations one should be reviewing. So, and thank you for allowing us to use the frequency, turning the frequency to general amateur use 7.3, and we'll continue on with our Zoom discussions. This is Whiskey Bravo 5 Delta AA4 FL at the mic saying 7. Thank you for being here with us, everybody. Thank you, Mark. 7-3. Okay, guys, on Zoom, let me turn down the radio. Sorry that we have technical problems here, so we're still having a recorded session for the public. It's on our Zoom portion right now. So I'll be looking for those of you to have a discussion in that round. Just give me 1 second here to get the this is AA4FM. Okay, guys, on Zoom, you can all unmute and talk, and radio should be off. Chet, was there anything that you, N5RTF, would like to say about this class of medications?
Yeah, actual true allergies are an individualized issue. I was taking naproxen during an episode of sciatica, and I developed dark blotches, several places on my skin. And I was seeing a dermatologist that week for something unrelated. And he looked at it and was, he named it and just said it was an allergic reaction. And I wasn't sure what it might be. I might be allergic to. And then I finally realized that it was the naproxen, and I stopped it. And it took probably about 6 months for the blotches to go away. But I've never taken naproxen again.
What about other medications in that class of NSAIDs? Have you ever had a side effect for any of the others?
No, I haven't. I've found them to be ineffective at times. In fact, with that episode of sciatica, turns out it was piriformis syndrome, and Flexeril, cyclobenzaprine, was the only thing that gave me any relief. Even codeine derivative was ineffective with the pain, but the Flexeril relieved it within probably about 6 hours.
So just at times muscle relaxants are needed for pain, not just pain.
Yeah, and Stewart was warning us about Flexeril, but if it's used selectively, it's fine. The one thing you don't want to do is give it to somebody with bipolar disorder. It's like rocket fuel. They'll have a manic episode that takes days to bring them down.
Wow. Thanks for reporting and contributing, especially hearing that from a psychiatrist, or retired psychiatrist, joyfully. One that hopefully gets a little time fishing now as well in the beautiful New Orleans area. Uh, Andy, WJ8B, being that you were in practice for many, many years, can you tell us a little bit? Can you unmute here and tell us a little bit about your use of these medications in clinical practice?
There we go. Hopefully I'm on now. Yeah, use the medicines periodically. Biggest issue I had was people using them chronically because they would, frequently end up with gastrointestinal issues. Occasionally you'll see allergic reactions, even, you know, angioedema type thing with them as well. Of course, with aspirin in particular, but the other NSAIDs, you can have increased bleeding if you're going to have surgical procedures or concerned about that around the time of delivery of a baby. You don't really want that bleeding to be excessive, of course. Um, the Yeah, I used to get periodically. Um, and I was on hospital duty, get GI bleeds from them, and some of them quite severe. Yeah, and I remember in the older days, one of the things that people used to use was Alka-Seltzer to help their abdominal pain, and that was a problem if they had a peptic ulcer because not only did it make the peptic ulcer pain worse, they oftentimes could have a pretty significant GI bleed as well. One thing we didn't mention is a lot of the modern drugs you see advertised on television, the $10,000 a month things for psoriasis, etc. Those are basically specific anti-inflammatories that are trying to block a pathway. So, that's a whole new science, which these drugs don't fit the classification, but it's, you know, I think there'll be side effects that come up from those that are discovered over a period of time. So back to you, Jay. So,
Thank you, Andy. When you do watch these commercials on TV, they sometimes when they read out the adverse effects, it's longer than the commercial itself. Don't you think that the public would be a little concerned about that? Are you?
well, you have to understand the climate of it all. These things are, of course, on television. Everybody's going to take that, and the drug companies are always concerned about getting sued. And probably rightfully so to some degree. That's why those long things get in there, and that's the balance you got to do. I mean, it's usefulness of the medication versus the risk. Take one of the more common uses are for inflammatory bowel disease. You have those risks, but then again, people die from inflammatory bowel disease, and these medicines literally can control them without steroids for long periods of time in the majority of patients, despite the fact that there are occasionally ones that have life-threatening complications. The overall benefit, when you look at all of them, is good.
What are some of this is a WJ8B here with us today. This is AA4 Feltamike. What are some of the medications that the steroidal anti-inflammatories are used for? What classes of disease? I mean, things like lupus. What else are they used for?
Well, there's lupus, uh, ulcerative colitis, psoriasis, you name it, anything that's inflammation. And there's lots of degrees. I mean, there's different diseases that fit that category that are, relatively common and relatively severe. Even some situations with low platelets are immune mediated. And we use steroids to treat those because that can be a pretty life-threatening issue. The um, Then there's lots of diseases, rheumatoid arthritis, another common one. Fortunately, the newer drugs work better for that work on the immune system than the steroids did, because steroids, even though they worked, had significant complication rates, especially if you use long term.
Well, the corticosteroids aren't, just for those that aren't in medical fields, aren't those emanate originally naturally from the body? A lot of
That's true. That's
corticosteroids.
correct. It is produced in the adrenal gland, and of course, at lower amounts than what you do if you give somebody an external medication. But it is a natural hormone.
Okay. So they've developed medications but the side effects are much greater with the steroidal medications. Is that correct?
If you, yeah, because you're getting them at a much higher dose than what you would normally from your own body. I mean, that's the issue. When the adrenal gland sends out steroids to help, um, for various situations, it comes out in micro amounts and then the amounts that's needed. Whereas if you're providing a dose of Decadron or prednisone, you're way exceeding what your adrenal gland's going to do, and it's continuous. So that's when the side effects accumulate.
Excellent. Thank you for the explanation. W9 NET, are you, John, are you here with us? It's been interesting to hear an OBGYN's point of view. And well, we appreciate everybody that's been here today with us to discuss non-steroidal anti-inflammatory agents. I hope this discussion has been helpful for the general public. Again, the Medical Amateur Radio Council and the Grand Rounds in the Air is a passion of amateur radio operators that are health-related fields. Historically, Sunday mornings were the time when physicians were most able to get together on the radio to discuss topics, and it continues to this day because they were doing rounding in the hospital the other 6 days more intensely. But thank you for everybody that's here with us. Okay, this is Andy now on the screen, WJ8P. Thank you for being here with us, Andy. Chip, you want to say hello to the group now that we have some video before we say goodbye? We had the conclusion screen on before. N5RTF, any parting comments?
Yeah, the only other thing I didn't comment earlier because it's not proven, but there are people who are suggesting that a link between the flesh-eating bacteria, Vibrio vulnicans, and non-steroidals, that non-steroidals, if taken before or during exposure to the Vibrio in salt or brackish water, will destroy your cellular immunity, which fights off the Vibrio infection and can leave you with severe skin infection that you might not have gotten if you weren't taking NSAID.
Thank you for the description, Jeff. We appreciate that. Well, guys, go ahead, Jerry. And
I was just going to comment on what Chip had said. He was talking about
please
the
do.
fact that he had piriformis syndrome with sciatica. And I speculated that I had piriformis syndrome, but I couldn't get confirmation from orthopedics, neurology, physiatry. But I'm doing better now with stretching exercises and swimming. And that leads me to the classification of complementary medicine. It's not necessary that we have to constantly look to find solutions that are medication. And going back to what you were talking about, I remember when I was in med school, we used to talk about the fact that acetyl salicylic acid, or aspirin, had 4 functions. It was used as an antalgic, an anti-inflammatory, an antipyretic, and also as a uricosuric. But if you're talking, and it's cleared by the kidneys. Now, if you're talking about Tylenol or acetaminophen, it has functions against pain and fever, but it has no effect on inflammation and no effect as a uricosuric. So you want to think of those things as, what are you targeting? And are you targeting an inflammatory process, or are you just targeting pain. So that's just the way to think about what the effects are of what the medications you're using. Also, the comment was made that it's contraindicated to use steroids for pain and muscle relaxants and gabapentin, but that's for acute pain. If you're dealing with chronic pain, then there is a role for gabapentin and steroids. But we have to go back to what we talked about the last time we discussed it. We said we have to look at what the therapeutic index is. The definition of that is the amount of agent causing toxicity compared to the amount of agent causing a therapeutic effect, and that creates what's called the therapeutic window. So we have to be aware that there are some medications that have an NTI, a narrow therapeutic window, and this requires very careful monitoring and precise dosing. And examples of that are with warfarin, which we use commonly as an anticoagulant, but also with lithium and other medications. So these are things we have to keep in mind. So what I always tried to do whenever I was involved in the links between patients and medication, I always advise them, start out the minimum medication that you can use. And I personally always, when I had prescriptions, I always cut everything in half and started out with a very low dose just to see what my reaction would be. And if I thought it was safe and I thought it was effective, I'd stay at that dosage. And then I would go up to the prescribed dose only if it was safe and I wasn't getting an effect from the medications. So I just think that this whole thing has to be put into context, and we have to look at it from the perspective of what can we do to try to really help the patient in a particular situation. And I think there is a role for complementary medicine, and there are things that we can do, not just like exercise, but there are things that we can do, and I think that Chip might know about this as well, to relax. You have the fight or flight reaction, and your heart rate goes up, and you're ready to deal with issues on that basis. But that is involving the orthosympathetic system, and there are ways that you can change and affect your and diminish the orthosympathetic effect and increase the parasympathetic effect. And one of the ways that I just learned with some from Primed with a presentation where you can just take a deep breath, hold it for 4 seconds, and slowly breathe out. And that will start to stimulate your parasympathetic system, and you can deal with it on that basis. So I think that depending on the patient, the interaction that you're having, you need to try to deal with these issues that can at least address the problem or potentially address it with some of the patients, and you can avoid getting into the medication kind of scenario that we start to run into an effect with. And part of the problem that we have when we're using cortisol, and it was pointed out, or corticosteroids, is that there are lots of effects that take place. It's not just the target that you want. When you take cortisol, you're increasing your blood sugar, and you are then putting yourself at risk for diabetes and all kinds of other problems. And so the reaction that we have is different in different people because we're not all cut out of the same cookie cutter. So we need to look at and be aware of all these possibilities. Those are just my comments listening to the discussion that we had this morning.
Great comments. I wish we would have gotten in there earlier, Jerry, to make those comments.
Yeah, one other thing that sort of goes along with that is the famous quote is attributed to a lot of different people, but you can never do just one thing. Anything you do affects something else, and that affects something else, and you institute a whole chain of events. So although we would love to have magic bullets that just treat one thing and have no side effects, it's not going to happen. It's not the real world.
And that's why we have to play whack-a-mole, because you start with one thing and you have instead of having the one effect, you have 3 or 4 effects, and you have to deal with the 3 or 4 effects. That's the reason why I always try to use minimum medication to try to deal with whatever the issue is.
Yeah, do you remember the movie Hospital? One of the subplots was the patient came in for an insurance physical, and anyway had something go wrong during the blood draw, and then he developed some other problem and an infection and all that. Anyway, the guy was finally in a coma on life support, because one thing just led to another, to another, to another. And finally, I think he died from his insurance physical.
That's I don't know whether that's apocryphal or that's real, but I'm sure that it happens in the real world. But since you mentioned a film, and or perhaps a TV series, one that I saw that I was just absolutely floored by, and I was intrigued, is, and you probably are aware of it, it's called The Pit. And I thought that was fabulous. And the only comment that I had about it when watching it was, one, every time someone came in, there was a presentation, let's say, from the first responders who drove in, and they gave you a complete workup and gave you all the vitals and all the information that you needed instantaneously. And I was going, that just doesn't happen in the real world. And the other thing was the amount of crises that they had one after another in just one location was just too much. I thought when I did the emergency room, I would have maybe 1 or 2 really serious problems in a 12-hour shift, but never one after another, after another, after another. But I was just intrigued by the way that film or that TV series portrayed what's going on. I thought it was quite interesting, and I was also intrigued by the development of a lot of modalities for addressing the issues that we used to see much more effectively with new devices. So I was fascinated by it. I'm waiting to see the new series that's going to begin in January.
Well, thank you, both of you. And thank you for everyone that's joined us today here on the YouTube recording. We hope you found this to be very helpful. Use our website as a reference, healthcarehams.org. Certainly all the other videos that are on our YouTube channel. And feel free to share with family and friends, other amateur radio operators, the general public, whoever, use. And we'll be back next time. We're going to be talking about the health benefits and risks of hot tubs. And until then, we'll look forward to seeing you at the next time.